Hello. Okay. Yes, I am. I am here. Let me set up this thing. It's 9 o'clock. Where is everybody? Did I send the wrong code? Okay. Hi. Nah, the Thanksgiving, I don't know. I was busy all through, honestly. Like before I say Jack, the Thanksgiving has finished. How was yours? Yeah, hello. Welcome. Hello. Where is everybody? It's past 9 already. We I was supposed to take you yesterday. I had a lot of time yesterday, but not like I have a lot of time yesterday anyway. But unfortunately, we were not able to have the session yesterday. Yeah, fast. Mine was also good. Okay, that's good. Same here. Good to see you. Good to see you. I wish everybody can come as fast as possible so that we can finish up, man. Okay. This. Hold on. Let me set up this camera properly so they can see me. Don't know why it's moving to the other side. I think this is better now. Aha, good. Okay, we're up to 20. My foot, my foot is terrible. Honestly, like, uh, it's just there. Honestly, like, I don't know. I'll take care of it next year, 2026. That foot, that leg is for 2026. Honestly. Oh, I just have patella dislocation. So my patella, that bone, is just shaking, going round without anything holding it. So the ligaments holding it, ruptured. So I'm supposed to keep this leg one place, but unfortunately I cannot because I have a lot of things I'm doing right now. I sent an email about the endocrine. Oh, did you? How come I didn't see it? When did you send me the email? I didn't see it, or maybe I'll check later. A lot of my messages is just available, available, available. So thank you so much. I appreciate. Okay, so we don't have much people here, but I'll just proceed. I can't start waiting for people that are too busy. I sent it a couple of minutes ago. Oh, minutes? Nah, nah, nah. I'm not checking my email right now. I'll check it later. My number is growing too slow. We're at 26. I was thinking that by now we'll be up to 80 here. Hmm? What happened? Where's everybody? They're too busy? Yeah. Okay. So, guys, I'm going to do a very short recap of what we've done in endocrinology before we start jumping into the questions. All right. So, can you see my slide? Just type yes. Can you see the slide? I shared the slide. Can you see? Yes. Okay. Perfect. Perfect. So, guys, endocrine system is we'll discuss endocrine system. We answer the questions, then we jump into male reproduction. All right. Now, no matter where you are, no matter the school, know that this is just a recap, all right? This does not substitute for your lectures or whatever. It's a recap of your exams, all right? Now, humans, for organization of human life, communication and coordination, It's specifically the endocrine system and the nervous system. We discussed the nervous system some times ago, right? If you've not learned more about the nervous system, please go back to the other streams I've done, go back to the videos I've uploaded and watch it. And when you finish watching it, please write ready, all right? At the end, that's the logo, the motto. Always write ready when you finish watching the video, all right? Now, the endocrine system uses hormones. We already know that. Why the nervous system uses neurotransmitters. That's why the nervous systems are faster. The nervous system is faster. Endocrine system is slower. Endocrine system uses hormones and it pours its content into the blood, all right? So that's just the most important information for introduction. Now, you need to know the mechanisms of endocrine system, the gap junction, the neurotransmitters, the paracrine, the hormones. You need to know these things. You need to know what they stand for. You need to know about the system itself, about the study, that's endocrinology, about the glands, and also about the hormones. These are extremely important. You need to familiarize yourself with this diagram. Please, if I'm being too fast, always tell me, tell me, hey, I should slow down, all right? But I just feel that you've already read this. That's why I'm just pushing it very fast. Now, this is the overview of the endocrine system, starting from the pineal gland that produces melatonin, all right, to the thyroid, to the thymus, to the pituitary, to the hypothalamus, all right? Remember, the hypothalamus produces hormones, the pituitary produces hormones, the thyroid produces hormones, the thymus produces hormones, all right? The adrenal gland produces hormones, the pancreas produces hormones, parathyroid gland as well, the gonads. These are the endocrine system, like the components of the endocrine system, all right? Remember, organs make up systems, as we discussed when we discussed the structural and cellular unit of life. Now, you need to be able to understand the difference between the exocrine and endocrine. When you're talking the exocrine, it has ducts. The endocrine, no ducts. Chicken, simple, no stress. All right. And most endocrine, exo, outside, it has extracellular what effects. All right. While endo, inside, it has what intracellular what effects. Chicken, no stress. All right. Okay. Now there are some systems that has both the endocrine and the exocrine system. All right. And this is the comparisons of between the nervous system and the endocrine system in terms of speed, in terms of adaptation, in terms of area of effect. You need to understand this. Now, these are the chemicals that they use. Several chemical functions as both hormones and neurotransmitters. Things like norepinephrine, dopamine, antidiuretic hormone, that's vasopressin. All right. Now, they have similar effects, but we are still going to discuss that later. All right. So I'm moving very fast. Then talk about the target organs of the cells. Then this is the comparison proper in terms of where they pour in. This one moves through the nerves. That's as electricity. That's nerve impulse. And at the end of the day, it comes here at the presynaptic membrane produces the neurotransmitters. All right. These neurotransmitters attaches to the receptors, in the postsynaptic membrane. Very, very important that you understand this. So this postsynaptic membrane, we call it what? Target cell. So in the target cell, in the plasma membrane, it has receptors that the neurotransmitter that was produced by the postsynaptic membrane, attaches to. Extremely important that you understand this. Yes. Yes, the endocrine is ductless. So the endocrine pours it into the blood and it moves from the blood and moves to the target organs. Extremely important that you know this. Okay. Now let's talk about one of the chief cells of the endocrine system, or the chief organs of the endocrine system rather, which is the hypothalamus. All right. Extremely important that you know this. And it has a lot of functions, but most of its functions is as a control of the pituitary. Now, the pituitary gland is suspended from the hypothalamus by the infundibulum. We call it a stalk, known as infundibulum. Remember this. Now, when you're talking about the structures, they are independent structures. We have the adenohypophysis and the neurohypophysis. These are the two parts of the pituitary attached to the hypothalamus. All right. So the hypothalamus is attached to the two parts of the pituitary, which is the adenohypophysis, that's the anterior, A for A, adeno, anterior. Then we have the neurohypophysis, that's the posterior. Extremely important that you know this. And if you look at this diagram, you'll be able to understand it properly. This is the adenohypophysis, that's the anterior. This is the posterior, that's the neurohypophysis. And this is the hypothalamus, the way it encloses the entire thing. So very important that you understand the anatomy. Remember, anatomy is location, 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 and structure, structure, structure. All right. Why physiology is its function. Now, you need to know that there's something, the link between the adenohypophysis and the hypothalamus is known as what? The hypophyseal portal system. They're going to ask you this question and I will show you. All right? Very, very important. Okay. So these are some of the hormones that guides the entire thing. This is the hypothalamic hormone. This is the anterior lobe hormones, and this is the posterior lobe. Now, what you need to know is that the hypothalamus hormones are releasing hormones. They are releasing hormones. So most of their name you see releasing. Like the gonadotropin releasing hormone, the thyrotropin releasing hormone, corticotropic releasing hormone, growth hormone releasing hormone. The ones that doesn't have releasing is the prolactin inhibiting. Prolactin what? Inhibiting hormone, and the somatostatin. Somatostatin is also an inhibitory hormone. So anything that is not inhibiting from the hypothalamus is what? Releasing. Check it out. That's the formula. Anything that is not inhibiting is what? Anything that is not inhibiting is releasing. And there are two inhibiting hormones. And about four releasing hormones. So in all, there are 6 hormones from the hypothalamus that goes to the anterior pituitary. 6 of them. Now there are 2 that goes to the posterior pituitary. So in all, if they're asking you how many hormones are produced by the hypothalamus, in total, there are 8 hormones. Very important that you know this. 6 goes to the anterior pituitary. What do they do in the anterior pituitary? They go to the anterior pituitary to encourage it to do what? To release hormones. All right? They encourage you to what? Release hormones. So in the anterior pituitary, once these 6 hormones comes, anterior pituitary releases about another 6 hormones. All right? Follicle stimulating hormone, luteinizing hormone, thyroid stimulating hormone, adrenocorticotropic hormone, prolactin, and growth hormone. These are the 6 stimulating. Mind you, the hormones from the anterior pituitary are what? Stimulating. These are the 6 stimulating hormones. Why the hypothalamic are what? Either releasing or what? Inhibiting hormones. So you should remember this. All right. Now I'm going to jump some of these. Now for the neurohypophysis. This is the neurohypophysis. All right. So what you need to know from the neurohypophysis stores hormone. It does not produce. Anterior, that's adenohypophysis, produces 6. The neurohypophysis stores. All right. These are the 2 hormones it stores. One is oxytocin. Another one is antidiuretic hormone. Oxytocin is produced by the paraventricular nucleus. Para, because it's a para hormone, as I told you. Why the antidiuretic hormone is produced by what? The supraoptic nucleus. Very important that you know these 2 things. Very, very important that you know these 2 things. All right? Okay. In your equation, they will not be asking you what produces oxytocin because you know it's hypothalamus. But they will be asking you which nucleus produces oxytocin. They'll be asking you which nucleus produces what? ADH. All right? Okay. So these are the hormones. We've already discussed them. This is exactly what I just told you. The paraventricular nuclei produces oxytocin. Supraoptic nuclei produces antidiuretic hormone. Very important that you know these 2 things. So these are the anterior pituitary hormones. We have the follicle stimulating hormone, the luteinizing hormone, the thyroid stimulating hormone. You need to know what they do. All right. I won't go into it now until we start asking the questions. These are other hormones. These are adrenocorticotropic hormone. This is prolactin. This is growth hormone. All right. Now, this is everything you need to know. If you take this diagram, you use it to do your wallpaper. Extremely important. Now, you see, this is growth hormone releasing hormone. When it comes to the anterior pituitary, it causes the anterior pituitary to produce what? Growth hormone. And the growth hormone goes to the liver and goes to the muscles, you see, to cause growth. Look at this second one that looks a little greenish. This is the, this is the gonadotropic releasing hormone. It goes to the anterior pituitary, makes the anterior pituitary to release what? Luteinizing hormone and follicle stimulating hormone. And these 2 stimulates the testes and the ovary. You see? Then if you look at this first one here, this first one produces what? This is the thyroid releasing hormone from the hypothalamus. It goes to the anterior pituitary and causes it to release what? To release thyroid stimulating hormone, TSH, and also prolactin. Extremely important. So use this picture to do your wallpaper, all right? We've already discussed this. If you look at this section, this is section of the pituitary and the hypothalamus cut and made bigger this way, all right? Now, the antidiuretic hormone is vasopressin. It increases water retention, right? So this is a hormone that's usually released by the hypothalamus, all right, anytime that the person is dehydrated, all right, because it increases water retention reduces water, urine, and prevents what? Dehydration. That's vasopressin or antidiuretic hormone. Why? Because it's constricting the vessels. Vasoconstriction, vasopressin. You can't forget these things. We already know about oxytocin. Oxytocin is usually released during sex. All right. You know, after sex, you are so happy. It is oxytocin that is making you so happy. Trust me. Mm-hmm. And also, oxytocin helps to bring out the milk. That's lactation. It doesn't produce milk. Production of milk is prolactin. Oxytocin helps to push it out. All right. Also, it's used for labor contraction. That's why we call it para hormone, because it's produced by the paraventricular arm. All right. So this talks about rate of secretion. You will see one question at least from it. This is feedback. We already know feedback. All right. This is a very good example of feedback. You look at it properly, you see an example of feedback. The thyroid releasing hormone produces thyroid. The hypothalamus produces thyroid releasing hormone, which goes to the pituitary. The pituitary pushes out what? Thyroid stimulating hormone, which goes to the thyroid. Then the thyroid releases what? The thyroid hormone, T3, T4. When T3, T4 goes to the target organ, and when it is produced too much, what happens? It will inhibit the production of TSH or inhibit the production of what? TRH. That's what we call negative feedback. Extremely important. Then we have positive feedback. Positive feedback is when the thing is produced, it leads to production of more. That's positive feedback. Negative feedback is when it is produced, it stops the production of more. It inhibits it, it reduces it. But positive feedback will continue that production. For example, oxytocin release will lead to more contraction. All right. Same thing with when somebody is losing blood, it will lead to more blood loss. All these things are positive feedback. They are rare, very, very rare. But the major one is what? The negative feedback. This is the growth hormone. You look at it later. I will ask you a question on growth hormone. This is how growth hormone induces the liver to act further. All right. This is how it induces the bones because it touches everywhere. All right. Very, very important. So the growth hormone causes the liver to produce insulin growth-like factor, IGF, which also helps in growth. All right. Fat growth, muscle growth, bone growth. Extremely important that you know this. Now, these are the other endocrine glands. We have the pineal gland that produces melatonin that helps you, for sleeping. All right. You can have disorder. We call it seasonal affective disorder. That's disorder in the pineal gland. All right. But nobody's asking you that. That's pathology. Okay. We also have the thymus, which is the site of maturation of T cells. Very important for immune defense. Extremely important. So this is the diagram of the thymus. This is in newborn. All right. This is thymus, how big it is in newborn. As you grow older, the thymus shrinks. Extremely important that you know this. It just shrinks as you grow older. Okay. So that's the thyroid. This is the hormones of the thyroid. I won't talk too much on it. Then this is the parathyroid hormone gland. Also very important. All right. Usually 4 glands at the posterior surface of the thyroid. It secretes what? Parathyroid hormone, PTH. We call it what? Phosphate thrashing hormone. Pushes out phosphates and it brings in calcium into the blood. All right. So very, very important. Increases the absorption of calcium. PTH majorly increase the absorption of what? Calcium. You need to know this. Then this is the adrenal. You need to know the regions of the adrenal glands. All right. This is the adrenal gland. It has what? The inner medulla and the outer cortex. This is the outer cortex. The cortex is divided into 3. We have the zona glomerulosa, we have the zona fasciculata, we have the zona reticularis. Each of them has what they want produce. Remember, adrenocorticotropic hormone, causes this adrenal gland to produce hormones. All right. Very, very important that you know this. We will still discuss them later. But another thing you need to know, one major thing you need to know is that the adrenal medulla produces what catecholamines. That's epinephrine, not epinephrine. Produces what? Catecholamines. Very, very important that you know this. All right. While glomerulosa, this first region, produces what? Mineralocorticoids like aldosterone. There's fasciculata produces what? Glucocorticoids like cortisol. All right. So when you go down, you see most of this. This in medulla is catecholamines, also dopamine in a very small quantity. Produces dopamine in a very small quantity. All right. Then this is the cortex. This is the fasciculata. This is the glomerulosa. This fasciculata. This is what? The reticularis. This is what they produce. All right. So I won't talk too much on them. I'm still running. This is the mineralocorticoids. This is aldosterone. I mentioned initially that stimulates sodium and potassium retention. That's salt retention. Extremely important. That's why we call it minerals, mineralocorticoids. Then this the glucocorticoids, all right? Cortisol, usually, majorly cortisol. You understand? Which helps you to adapt during inflammation and also during stress. Anyway, inflammation is stress. All of us know this. Inflammation is stress. Also, this is sex steroids that they produce. All right. And then we talk about the pancreas. We know what the pancreas produces. It has different alpha cells, different cells, alpha, beta, even delta cells. All right. The alpha cells produces what? Glucagon. While the beta cells produces what? Insulin. Insulin and glucagon, they act opposite of each other. That's what you need to know. Insulin and glucagon, they act opposite of each other. And we have the somatostatin, all right? This one inhibits. Anything somatostatin inhibits. It inhibits. Very, very important that you know this, all right? Okay, so these are the gonads, the ovarian hormones from the ovaries produces estradiol, progesterone, and inhibin. While the testicular hormones are the testosterone, estrogen, and inhibin. Very, very important that you know this. Ovarian hormones, estradiol, progesterone, and inhibin. Testicular hormones, testosterone, estrogen, and inhibins. That's weaker androgens. Very important that you know this. These are their functions. I'm not going to talk about it right now. Okay, now another thing you need to know is that the kidney also plays a very big role. The skin, first of all, plays a role in producing the cholecalciferol. The liver plays another role because it converts cholecalciferol to calcidiol, all right? Why the kidney converts this calcidiol to calcitriol. Very, very important. The calcitriol helps increase, increase calcium absorption. Extremely important. So the calcitriol supports what? PTH. You need to link up. You need to link, all right? Also, the kidney produces what? Renin. We already discussed the RAS system. Renin angiotensin aldosterone system. That's the RAS, all right? It also produces what? Erythropoietin, which stimulates bone marrow to produce red blood cells. That's why if somebody is having kidney problem, the person is having what? Anemia. Extremely important that you know this. Then we have the heart, also produces hormones, all right? We call it nutritive peptides, all right? This helps to lower the blood pressure. All these things is for homeostasis. Now we have the adipose that produces leptin. I told you leptin makes you thin. Leptin makes you thin. Very, very important. Then we have the bone marrow that also produces osteocalcin, and the placenta that produces what? Estrogen, progesterone. All these things are are organs that produces what? Hormones. Extremely important. So now that we are done with the organs, these ones are just the types of the classes of chemicals that are produced. Like we have the steroids, we have the monoamines, we have the peptides. The steroids, example, are the hormones produced by the gonads. Like what? Like estrogen, like the cortisols from the adrenals, or the corticosteroids from the adrenals. All these things are what? Steroids. Then we have the monoamines. Another name for monoamines is what? Biogenic amines. Very, very important that you know this. Major examples of monoamines are the catecholamines. That's dopamine, epinephrine, norepinephrine. We also have the melatonin, the thyroid hormone. So you need to know which hormones are steroid, which hormones are what? Monoamine. Look at this diagram, you will be able to understand why they are what they are. These are the steroids, major examples of steroids. These are the major examples of monoamines. You need to remember this, all right? Then we have the peptides. The peptides, extremely important. You know, all the hormones produced by pituitary are peptide hormones. Very, very important. And also the releasing and the inhibiting hormones from the hypothalamus. All of them are what? Peptide hormones. They are proteins. Insulin is also a very large peptide hormone. So you need to know this, all right? Okay. Peptide hormones, they are proteins, so they follow the normal protein synthesis, all right? If you don't know about protein synthesis, go watch my video on gene. It's there on YouTube. Go watch the video on gene so that you'll be able to understand the hormone synthesis. Okay. So also for hormone secretion, we have the neural stimuli and we have the hormonal stimuli. Neural stimuli is, you know, from the brain, the nerve fibers, the sympathetic, usually, and the parasympathetic. While the hormonal are the ones when a hormone synthesizes another hormone or causes another hormone to be produced. For example, the hormones from the hypothalamus, which regulates the anterior pituitary hormone. That's an example of hormonal secretion or hormonal stimuli. All right? Very, very important. Then we have the humoral. Mind you, we have what? 3: neural, hormonal, and humoral. You need to know the example of these 3. When you're talking about humoral, you're talking about anyone that's caused as a result of what? stimulation from the blood. For example, when there is high glucose concentration in the blood, it leads to the production of what? Insulin. When there is low concentration of glucose in the blood, it leads to the production of what? Glucagon. When there is low osmolarity of the blood, it leads to secretion of what? Aldosterone. Aldosterone will now bring a lot of water inside the blood. Very, very important. All right. When there is low calcium in the blood, it leads to what? Increase in parathyroid hormone production. All right. So these are humoral. Humoral. So very, very important that you know this. All right. This talks about hormone transport and hormone action. And mind you, hormone usually work through what? Receptors. So most hormones are what we call what? First messengers. All right. This is an example of what I'm talking about. This is peptide hormone. This is how it acts. So when it comes to the, this is the cell. All right. For peptide hormone merges with what? The receptor. It doesn't go inside. It merges with what? The receptor. But steroid hormone goes inside and merges with the receptor. But at the end of the day, all of them leads to what? Various metabolic activities inside the cell. So you need to understand this. It depends on the route. They ask you peptide hormone, it doesn't go into the cell. Instead, it merges with the receptor on the cell membrane. But the steroid hormone, its receptor is inside the nucleus. So it has to enter the cell, enter the nucleus, and merge with this receptor to cause gene transcription. That gene transcription will lead to what? Protein synthesis, which leads to what? Various metabolic activities. Extremely important that you know this. All right? Okay, so I'm going to jump most of these things. All of them still follow the same way we discussed initially. This is the receptor. All right? This is the hormone. The hormone is first messenger. All right? Extremely important that you know. This is the receptor. This is the hormone. The hormone first messenger leads to detachment of G. The G links with adenylate cyclase, which converts ATP towards CAMP. CAMP is the second messenger. This CAMP is what activates the kinases, which leads to what? Activation of everything that happens inside the cell. And these are the hormones that follows this pattern. Why for this guy here, the same thing happens. But instead of adenylate cyclase, this one is what? Phospholipase. This phospholipase triggers what? DAG and IP3. IP3 starts calcium activity. All right. Why DAG leads to protein what? Activity. So it has two phases when you are working with these particular hormones. And the hormones that follows this pathway is hormones like ADH, antidiuretic hormone, TRH, oxytocin, LH, and catecholamines. All these particular hormones, they work with this method. Why these hormones that are mentioned here, like ACTH, FSH, LH, and others, they follow this method. So you just need to familiarize yourself with this thing. Very, very important. All right? Because this is hormone signaling. Another thing you need to know about hormone signaling is hormone starts with a small stimulus. Just a little small thing can trigger the entire great metabolic activity. That's what we call what? Amplification. That's signal what? Amplification. All right? Very, very important that you know this. So we also have what we call modulation of target sensitivity. All right? We have upregulation and what? Downregulation. Upregulation is when the sensitivity is increased. Downregulation is when the sensitivity is reduced. All right. So these are upregulation. This is downregulation. This is how it works. It triggers low receptor density, weak response. From there, it leads to stronger response. But this is high, strong response. From there, it leads to diminished response. This is what? Downregulation, and this is upregulation. You see a very, equation on regulation. All right. Now, this is hormone interaction. We have synergistic effects, we have permissive effects, and we have antagonistic effects. Just, know these things and know how it works. Synergistic is just when they couple together to have a greater effect. All right. Permissive is this allows this, but it doesn't. They don't join together to work. Why antagonistic is something like glucagon and what? Insulin, because they oppose each other. That's antagonistic. All right. Permissive don't oppose; they are just allowed. Extremely important that you know this. All right. And this talks about hormone clearance, stress adaptation. We have different ways the body adapts to stress. All right. We have the alarm reaction. We have the stage of resistance. We have the stage of exhaustion. All right. So you need to know these three stages. But know that after in the stage of exhaustion, the result is what? Death. Death results from heart, kidney infection, or overwhelming infection. All these things are stage of exhaustion. When your body is tired, your body dies. That's as simple as that. All right. Then this is echonocytes and paracrine signaling. I won't talk much on them, but because if you know this eicosanoids very well, then you'll be able to understand, NSAIDs a lot, all right? Because that's how NSAIDs work, right? So this is eicosanoids, this is lipo-oxygenase pathway, all right? Producing leukotrienes, extremely important. So if you look here, you will see some of these cyclooxygenate enzymes, or the things that they convert to, all right, or hormones that they convert to. Things like prostacyclin, like thrombosans, the prostaglandins. Prostaglandins, for example, has a lot of effects in the body, which we are not going to discuss now. We discuss it more when we are talking about what? Pathology. Now we will not talk about it much, all right? So as I mentioned initially, you need to know NSAIDs. NSAIDs is non-steroidal anti-inflammatory drugs, all right? These are the drugs that counter NSAIDs, counter inflammation rather. We call them what? NSAIDs, like cortisol, corticosterone, aspirin, ibuprofen, celecoxib, all right? When you start doing pharmacology, you study these things properly, and you know the side effects and all those things. But this is anatomy and physiology. They don't ask you most of these questions, so I'm going to leave it. Then this is disorders. They don't ask you questions on disorders because this is pathology, anatomy and physiology, not pathology, all right? So look up these pathologies later, all right? The hyposecretion, the hypersecretion, and and others. These are pituitary disorders that you need to know later, all right? So I think that is that. Let me see. Is there something else we need to discuss? Diabetes mellitus. This is pathology. This is ketonuria. This is pathology. Cushing syndrome, pathology, adrenal. Okay, so I think that's that. So this is a very brief recap of what is cortisol the most potent glucocorticoids? Yes, that's why we are talking about it a lot. All right, it's the most potent because that's what has a lot of effect on your body. All right, very, very important that you know that. Okay, so I think we are done with this recap. This is a very fast recap, guys, not the teaching actual thing. If you need the actual thing, I have a reproduction video. Go watch it, all right? I'll throw you questions now. How many are we here? We are 22? Interesting. Okay. Are you ready? Let me see how many people are here. Let me see how many of us are here. He said, yes, we are ready. Okay. Okay. A lot of ready. Okay. Okay. Let me see how many people we have here. 24 people. Interesting. Why is this video too close? Let me shift it back. I think this is better. Okay. Okay. Let me see. How many ready do I have here? 1, 2, 3, 4, 5, 6, 7, 8. We have only 8 people here. 9. Okay. So the rule of the game is at least I need 15 people to respond, because since you guys are just 22 here, I need 15 people to respond. All right. And it's very fine that we are even fewer. I think when we are fewer, we even go faster. So the people that are too busy to be part of this session, that's fine. That's their problem. So we will. Yeah, that's fine. Okay, so let's start. So please, everybody has to attempt the questions. All right, everybody. I will need at least more than 10 people to make attempts for me to move to the next question. All right, it's very, very important. So we need to work together since we are fewer today. So this is hold on, let me give you the options. So which of the following best describes a hormone? It's okay. Take your time. This is A. This is B. This is C. This is D. And this is E. Okay, so which of the following best describes a hormone? A chemical messenger transported by the bloodstream that stimulates target cells in another organ, often a good distance away. B chemical messenger that diffuse from their point of origin locally to affect other cells' physiology. C chemical messengers that travel across a synapse to stimulate another cell. D junctions between cells interconnecting their cytoplasm. D, a chemical messenger that is triggered by the binding of a ligand on the cell surface and causes a change in DNA transcription. Okay, this is just testing the microphone. Okay, this is good. I think the people that are here are the very active people. That's good. I like it. Okay, that's good. That's good. You guys are correct. That number 1 is the answer. So look at this question. We're just testing the microphone. These are just cheap questions, all right? Which of the following is not an endocrine organ? Spleen, pineal gland, thymus, neurohypophysis, testis. Yes, the answer is A for that one. Which of the following is not an endocrine organ? Spleen, pineal gland, thymus, neurohypophysis, testis. Answer quickly. This is testing the microphone. Which is not an endocrine organ? Spleen, pineal gland, thymus, neurohypophysis, testis. Quickly, guys, testing the microphone. Yes, very correct. The answer is spleen. Okay, just testing the microphone. So look at this question, guys. Yes, that answer is spleen. Look at this question. Perfect. Spleen, you're correct. Look at this question. The dash can be found as part of the epithalamus near the superior colliculi of the midbrain. Hypothalamus A, B, pituitary gland, C, pineal gland, D, hypophysis, E, adrenal gland. A, hypothalamus, B, pituitary, C, pineal gland, D, hypophysis, E, adrenal gland. Yes, you guys are so correct. The answer is pineal gland. Yes, pineal gland. Remember, usually this hormone question, when they ask you hormone, think hormone. All right. The answer is pineal gland. Yes, look at this. What is the abbreviation for the hormone known as vasopressin? I'm not giving you the option. This is one question they asked in College of Staten Island. Number 1 question last year. Number 1 question last year. What is the abbreviation for the? Hold on, let me look at it. You see, the first 10 question is is hormone? The first 10 questions is hormone. Wow, and they actually asked pathology questions. Why was I jumping it? They asked pathology questions, guys. Thank God I saw this. I brought this thing. They asked pathology questions. That means I'm gonna ask you pathology questions. Yes, they did, because here I see a question that is talking about Cushing syndrome. Cushing disease result from an excess of dash. You see? Interesting. Interesting. Maybe I'll use this for your final review. Yes, they asked pathology questions. Yes, this is final of last year, College of Staten Island. This is final for, let me see, for which school is this? Is it New York? But this is for College of Staten Island. First 10 questions I'm looking at. I can ask you quick question from this, but I want to reserve this thing for. They asked question on the delta cells of the pancreatic islets. They asked questions of type 2 diabetes. They asked questions of Cushing syndrome. They asked question on antagonism and synergism. Two hormones that have opposite effects are called DASH. They asked a question on it. They asked a question on the term used to describe excess production of urine is called what? Polyphagia, polydipsia, glycosuria, polyuria, hematuria. I'm going to do a final review for you guys, but I will send a message if I don't get up to 50 responses, and if I come on and I don't have 50 people, I will stop. For real. Honestly, for real. That's what I'm going to do. I know you got this, but you know, some of you don't got this. And after they want extra points. That would be hard though. Anyway, the answer to that question is ADH, antidiuretic hormone, ADH, all right? That's the same thing as vasopressin. Remember, it is produced by the hypothalamus and stored in the posterior pituitary of the posterior pituitary, all right? That's the neurohypophysis stored there, all right? And when you are dehydrated, it's produced straight out. Look at this question. Hold on, let me look at it. No, let me see. Look at this question. I think you need to send the announcement earlier in the day. Some people didn't see it tonight. You guys have group chats. So when you guys have group chats, so when you see it, you put it for those people. And besides, those people that didn't see it, I sent a message yesterday. And a lot of people sent me a message back that, hey, Professor, I thought you said Sunday. I said, okay. Okay. All right. I said, okay. And I sent the message today. So they don't have reason. And another thing is that sometimes I don't want to send message too early and I would disappoint. The disappointment must not come from me. It must not. Do you understand? So if you know that, for example, I want to have a second review with you guys on Tuesday, depends on when I come back to the house. If I'm driving from Manhattan on Tuesday by 7 p.m., I have to get to my house before I send you the time. Because I may tell you, okay, I'll be here by 8, and you know, traffic will hold me and I come late, and I don't want to keep you guys hanging. So you know that I have this thing. You have to be alert. Once I send the message, you get it. And you don't even need, what you need to do is to click on the notification on my channel so that whenever I go live, you will see it automatically. I don't need to send a message. All right? Okay, so let's proceed. Let me see. Somebody said something. I have my 4-year-old login. Do this. Okay, so the thing is that once you get the notification, try to send to your group chats. That's why you guys have group chats. In College of Medicine, I have several group chats. I have the general group chats. I have the Inakakus group chats, the people I read with group chats, a lot of group chats. So you guys have to do that. You have to uplift each other, all right? Okay, so let's go, guys. Which of the following is the correct abbreviation for the hormone that stimulates the anterior pituitary to secrete ACTH? What's the hormone? I'm not giving you option, guys. What's the hormone? Quickly. ACTH. Okay, let me give you options. We have CRH, we have GHRH, we have GHIH, we have the APRH, we have the TRH. Which of the following is correct abbreviation for the hormone that stimulates the anterior pituitary to secrete what? ACTH. We have the CRH, we have the GHRH, we have the GHIH, we have the APRH, we have the TRH. Come on, guys, let's go. Wow, they asked a lot of questions on hormone, though. You see what I was talking about? Look at this question they asked, guys. Sorry, I'm not reviewing this, all right? I'm not reviewing it, but I just saw a question that interests me. Look at this question. We are not treating it, all right? We're not treating it, but I'm just giving you tips so that you don't miss any review when we call for reviews. A question says, wow. The principal hormones secreted by the corpus luteum is dash. Then another hormone is the granulosa cells of developing follicles secretes dash hormone. The granulosa cell. Which hormone does it secrete? Okay, I think this is female this thing, reproduction. You see, which hormone plays a central role in determining the rate of sodium reabsorption and potassium secretion? Leptin is to satiety as dash is to hunger. You remember when I was teaching this, I mentioned leptin. It makes you, leptin makes you not to eat, right? Then ghrelin makes you want to eat. Grrr. Grrr. I mentioned it. Wow. The hormone that dominates during the alarm phase of the general adaptation syndrome, GAS. Alarm phase. Remember we mentioned 3 phases. The hormone that adapts is cortisol, thyroid hormone, epinephrine, aldosterone. We're going to discuss this thing, guys. This is very interesting. This is extremely interesting. We'll discuss it for a final exam. Okay. Yes, the answer to that. No, I'm not answering this one. The answer to that question is CRH. All right. CRH. Which of the following is the correct abbreviation for the hormone that stimulates the anterior pituitary to produce ACTH? So CRH, corticotropic releasing hormone produced by the hypothalamus, stimulates the anterior pituitary to produce what? ACTH that goes to the adrenals. All right. Okay. Let's move. Look at this question. Oh. Look at this question, guys. That's the question. And let me give you the option. Just give me a minute. Let me give you the option. You know what? I think I will do something. Hold on. Makes it faster for me. Perfect. So these are the options. This makes it faster so that I don't need to be pasting it in the group. Look at the options. I'll paste it here. I hope you can see it. I don't know if it's big enough, but okay, so that's the options. The nerve system reacts to stimuli dash compared to the endocrine system, adapts dash compared to the endocrine system, and has dash effects compared to the endocrine system. Quickly, guys. Options. Slowly, widespread, quickly, slowly, specific, quickly, quickly, widespread, quickly, quickly, specific, slowly, quickly, specific. Answer. Quickly, quickly, specific. Mhm. Keep going, guys. Keep going, keep going, keep going. We are fewer, so we need to be faster, right? Keep going. Keep going, guys. Yes, you are very correct. The answer is quickly, quickly, specific. Okay, everybody got that, so I'll move. That's D. Yeah, you guys are correct. What makes a cell responsible to a particular hormone? So look at this question. My laptop is making me very slow. Sorry. I'm getting a new laptop today. Tomorrow, rather. So look at this question. This is the option. What makes a cell responsive to particular hormone? What makes a cell responsive to a particular hormone, guys? Is it Cyber Monday laptop? Yes. Is it cheaper on Cyber Mondays? I wanted to buy during Black Friday. Everybody said I should not buy. That I should wait for Cyber Monday. He said it's come on Black Friday. Really? Never heard that. Yes, you guys are so correct. That answer is B. All right. The presence of a receptor. We already discussed it. All these things are just straightforward questions. Maybe I should start. I want to give two more, then I go to the major questions that you need to know. Some companies do that. Okay. Look at this question, guys. The hypophyseal portal system connects the dash with the dash. Answer. These are the options. The hypophyseal portal system connects the dash with the dash. Anterior pituitary, hypothalamus, posterior pituitary, hypothalamus, anterior pituitary, posterior pituitary, hypothalamus, thyroid, pituitary glands, thyroid. Answer. He said, whatever you believe in, don't choose Amazon. Yeah, I wanted to buy on Amazon, but I tried the Apple store and I see that they give discounts to professors. So they gave me like $200 discount. I was so happy. Yeah. Come on, guys. So the hypophyseal portal system. Yes, you are very correct. The answer is A. Anterior pituitary to hypothalamus. Anterior pituitary to hypothalamus. How about the infundibulum? How about the infundibulum? Let me give you this question. Look at this question. So I need you guys to know the difference, all right, of the infundibulum and the hypophyseal portal system. Look at this question. Let me give you the option. This is the option, guys. So let's go. The infundibulum is a dash. A, mass of endocrine and neural cells. B, portal system between the hypothalamus and the posterior and the pituitary gland. C, bulky nucleus composed of paraventricular nucleus and supraoptic nucleus. D, depression of the sphenoid bone that protects the pituitary gland. E, projection of the hypothalamus from which the pituitary gland hangs. Come on, guys. Come on. We need to be faster. What's happening now? Why are you not sure? More. I need more people, at least 10 people. Okay. Okay. So that question is talking about the infundibulum. The infundibulum, the answer is E. It projects the projection of the hypothalamus from the pituitary gland. All right. So the pituitary gland hangs the hypothalamus. All right. So if this is the pituitary gland, this is the anterior, this is the posterior. The hypothalamus is hanging. So this thing, you see this thing between this my key and all this body of the key and all these things. This is the infundibulum. This is the infundibulum. All right. Now from the infundibulum, there is something, a system between that hypothalamus and the anterior pituitary. That's what we call what hypophyseal portal system. All right. So that's the difference between a infundibulum and a hypophyseal portal system. Okay. Let me go to the more serious questions, guys. So look at this question. Eicosanoids, where are they derived from, guys? More serious questions. Eicosanoids, where are they derived from? Let me give you options. We have arachidonic acid, leukotrienes, prostacyclin, prostaglandins, thrombosans. Eicosanoids, where are they derived from? We have arachidonic acid, we have the leukotriene, we have the prostacyclin, we have the prostaglandins, we have the thrombosans. Quickly, guys, quickly. Eicosanoids, where are they derived from? Yes, it's arachidonic acid. Please, if you don't know that question, please go and know it now. It's arachidonic acid, all right? So look at this question. DASH are secreted by the cell into the tissue fluid, diffuse to the nearby cells in the same tissue, and stimulates their physiology. A, neurotransmitters, neuromodulators, hormones, parahormones, and paracrines. Answer. Yes, the answer is paracrines, guys. The answer is paracrines. Look at this question. The initial response to the stress is called the DASH and is mediated. Yes, the answer is paracrine. The initial response to stress is called the DASH and is mediated mainly by DASH. Look at the options. I posted it on the picture. It's mediated by resistance stage cortisol, resistance stage aldosterone and cortisol, alarm reaction norepinephrine and epinephrine, alarm reaction cortisol, exhaustion stage norepinephrine and epinephrine. Answer. Yes, the answer is alarm reaction. And alarm reaction is not epinephrine and epinephrine. They asked a similar question. Let me see the question here. I saw that question some minutes ago. Where is that question? You see? Thank you. So, okay, somebody said D, somebody says C. So the answer is C. The initial response to stress is called what? Alarm reaction. And it's mediated mainly by norepinephrine and epinephrine. See the question they asked here for the main exam last year. It's a very similar question. They asked, pay attention, they say, the hormone that dominates, pay attention, they say, the hormone that dominates during the alarm phase of the general adaptation syndrome. You see? The hormone that dominates during the alarm phase of the general adaptation syndrome. A, cortisol. B, thyroid hormone. C, epinephrine. D, aldosterone. E, testosterone. What is the answer, guys? The hormone that dominates during the alarm phase of the general adaptation syndrome, GAS, is A, cortisol. B, thyroid hormone. C, epinephrine. D, aldosterone. E, testosterone. Answer. You guys are reacting slowly. I thought because we are fewer here, you'll be reacting very fast. Yes, epinephrine, you see? Let me see. Yes, epinephrine. Yes, epinephrine. From what we discussed, epinephrine and not epinephrine, and it's epinephrine. Now look at this question, guys. Look at this question, guys. You need to understand it. During the exhaustion stage of the general adaptation syndrome stress response, stress overwhelms homeostasis. One characteristic of this stage is the dash. A. Glycogen supplies are depleted. B. Energy demands are met primarily by fat metabolism. C. Fermentation is not enough to provide the necessary ATP. D. Energy demands are met primarily by protein metabolism. E. Energy demands are met primarily by carbohydrate metabolism. What's the answer, guys? What's the answer? Let me see. Someone say E. D. No. A. No. C. Good. I like this. During the exhaustion stage of the general adaptation syndrome, stress overwhelms homeostasis. One characteristic of the stage is that dash. Okay, this is tough now. So the answer to that question is D. Energy demands are met primarily by protein metabolism. By then, carbohydrate has finished, though. Do you understand? So it is left, the protein is now breaking down. Your body is now breaking down. All right. That's why exhaustion stage is same stage as what? Death. The answer is D. D. Energy demands are met primarily by protein metabolism. Protein is breaking down at that moment. All right. Yes. No, it's not A. No, it's not A. The answer is D, guys. It's D. Now look at this stage. Look at this question. You really need to understand each of these things, all right? Because they set it a lot in the exam. The resistance stage in the general adaptation syndrome stress response is dominated by what? The resistance stage is dominated by what? A. Cortisol. B. Epinephrine. C. Not epinephrine. D. Angiotensin. E. Aldosterone. No, A is not correct. The answer is D. Please. The answer is D, not A. All right, let me see what they say in A again. A. Glycogen supplies are depleted. No, glycogen supply depletion of, if you starve between today and tomorrow, your glycogen will be depleted now. That one is a normal thing that happens when you don't eat for a full day. You understand? Your glycogen will be depleted because when you don't eat, glycogen starts being converted to what? To start being converted to glucose. So that one doesn't even. This one is what happens normally. Protein breakdown is at the end of the entire thing. That's why if you see dead people, their body is decaying. The protein is breaking down. All right. Okay. So look at this question, guys. The resistance stage in the general adaptation syndrome is dominated by what? Cortisol, epinephrine, norepinephrine, angiotensin, aldosterone. Yes, the answer is cortisol, guys. The answer is cortisol. You're very, very correct. The answer is cortisol. Look at this question. Any situation that upsets homeostasis and threatens one's physical or emotional well-being is called dash. A. Stress. B. Pathology. C. Disease. D. Hypothyroidism. E. Hirsutism. It's quite crazy. Any situation that upsets homeostasis and threatens one's physical or emotional well-being is called A. Stress. B. Pathology. C. Disease. E. Hypothyroidism. And the last one, hirsutism. Yes, you guys are so correct. The answer is A. Stress. Somebody said my ex. Kill me. Kill me. Any situation that upstairs, even states that threatens one's physical or emotional. Don't mind me, I'm laughing like a crazy person sometimes. Hey, you got me. I don't know who said that, but that person really got me there, honestly. He said my ex. Hey, justice for X. So justice for X. Hey, you're very funny, man. It's a good answer, man. Justice for X. Hey, God, oh. I hope your ex is not saying the same thing about you right now. I hope he's not saying the same thing about you. Hmm. Let me see. Okay, so look at this question, guys. See my ex. Circulating hormones are mostly taken up and degraded by the dash and the dash. Circulating hormones are mostly taken up and degraded by the dash and the dash. Quickly, quickly, guys, quickly, quickly, quickly. You know, the truth of the matter is that I think because of the number of people here, we are even less than 20. That's too poor. We are going to take only endocrinology this night. I think that makes sense. Then, because I need the entire house to be there when we are discussing the majority of the thing. You understand? So, when we finish endocrinology, we. Yes, the answer is B. Circulating hormones are mostly taken up and degraded by the liver and the kidney. No, it's fine. It's fine. It's fine. I see you. It's fine. It's fine. Yeah, it's fine. Yes, the answer is B. Liver and kidney. Very, very correct. Look at this question. Look at this question, guys. Glucagon increases blood glucose concentration and insulin decreases it. This is an example of what? Look at the options. Glucagon increases blood glucose concentration and insulin decreases it. This is an example of what? You say, wait, repeat question. Liz, you only put the answers. I don't know what you're saying. Repeat the question. Yeah, the question I'm talking about insulin and glucagon now. Like glucagon increases blood glucose concentration and insulin decreases it. This is an example of dash. The question, yeah, I'm always putting the question in the chat. Or didn't I? Oh, I didn't? For the last one, sorry. Thought I did. Let me put it. Thought I did. This is the question actually, sorry. Glucagon increases blood glucose concentration and insulin decreases it. This is an example of what? E. Yes, you guys are very correct. That's antagonistic effect. Yes, antagonistic effect. Now use that same question. Use that same question to answer this. That same option to answer this. Look at this. That same option. Use it to answer this. Use it to answer this. Let me see. Yes, the other one is antagonistic effect. Insulin and glucagon is antagonistic. Neither follicle stimulating hormone, FSH, nor testosterone alone can stimulate significant sperm production. Whereas when they act together, the testis produces some 300,000 sperm per minute. This is an example of which principle regarding hormones. Yes, E, that's antagonistic. That's for glucagon and insulin. You're correct. But we are asking another one now. This time, another FSH and testosterone in production of sperm. Yes. So for this is synergistic because they are working together. All right. That's synergism because they are working together. Okay. Let me give you whichever target cells includes estrogen. Um, yes, see. I'm coming whichever is in the rough in the person. Trying to navigate some of these questions, whichever organs have put endocrine. Hmm. Okay. Yes, look at this question. Hold on, I'm trying to. Yes, that's synergistic effect. Yes, you're correct. Now look at this question. The dash secretes growth hormone, which is also known as somatotropin. You need to know the difference between somatotropin and somatostatin. Statin is inhibitory, but growth hormone is somatotropin. Dash secretes growth hormone, which is known as somatotropin. We have posterior pituitary, we have anterior pituitary, we have the hypothalamus, we have thyroid, we have the thymus. Which one? Which one, guys? You want the option again? We have the posterior pituitary, we have the anterior pituitary, we have the hypothalamus, we have the thyroid, we have the thymus. Okay, the answer is anterior pituitary. You guys are very correct. Look at this question. Yes, the anterior pituitary. Look at this question, guys. Look at this question. Which of the following is not secreted by the pancreas? Which one is not secreted by the pancreas? I want to post the options. So look at the options. Which one is not secreted by the pancreas? Quickly, quickly. Which one is not secreted by pancreas? Glucagon, insulin, amylin, somatostatin, which is growth hormone inhibiting hormone, and somatotropin, which is growth hormone. Answer. Quickly, everybody. Quickly. Yes, the answer is E. Is somatotropin, growth hormone. Somatotropin, growth hormone. That one is anterior pituitary. All right? Not pancreas. Okay, look at this question. Diabetes insipidus is caused by. Diabetes insipidus is caused by. Yes, the answer is E. Somatotropin. You're correct. Look at this question. Diabetes insipidus is caused by. Look at the options. Yeah. Look at the options. Diabetes insipidus is caused by. Yes, the answer to that question is somatotropin. Yes, growth hormone. Diabetes insipidus is caused by, we have epinephrine hypersecretion, we have cortisol hypersecretion, we have aldosterone hypersecretion, we have antidiuretic hormone ADH hyposecretion, we have the antidiuretic hormone ADH hypersecretion. Answer, guys. Yes, you guys are so correct. The answer is antidiuretic hormone hyposecretion. Think about it. What is insipidus? You are a lot of urine. You are pouring out a lot of urine. All right. Aha. And what does ADH do? ADH stops you from giving out a lot of urine. You understand? Aha. So no, not cortisol. For cortisol, you talk about Cushing, but this time around we are talking about what insipidus diabetes. That is ADH hypo. Please mind you, don't go and choose ADH hypersecretion. It is ADH hyposecretion, because if ADH is secreted high, you understand, that means you will not be urinating at all. Yes, ADH hyposecretion. Thank you. You have to note that. All right. Look at this. Look at this. I'll read the options. Or rather, let me just post the options. The posterior pituitary releases dash. Prolactin, adrenocorticotropic hormone, ACTH, oxytocin, OT, thyroid hormone, TH, growth hormone, GH. You need to know the abbreviations because they ask abbreviations. You need to know the abbreviations. The posterior pituitary releases what? I know you know it. Quickly, guys, quickly. Quickly, oh. We're up to 30 people. Quickly. Quickly, guys. Yes, the answer to that question is oxytocin. Very, very important. Huh? Look at this. That's how I remember it. Yes, oxytocin and ADH. Yes, in the posterior pituitary. Yes, you're correct. Is it oxyposexy? I understand it. Oxytocin produced stored in the posterior pituitary, And it usually causes sexual stuff. Okay. The sexual stuff, we'll discuss it on Tuesday. Depends on you guys anyway if you respond. So look at this question, guys. Which of the following is not a hypothalamic hormone? I'm going to put the options for you in the this place. Okay. Look at the options. Which one is not a hypothalamic hormone? Which one is not a hypothalamic hormone? We have the antidiuretic hormone, we have the luteinizing hormone, we have the thyrotropin releasing hormone, we have the somatostatin, we have the prolactin inhibiting hormone. Which one is not a hypothalamic hormone? Remember, we have 8 hypothalamic hormones. 6 goes to the anterior pituitary, adenohypophysis, and 2 goes to what? The posterior pituitary. That's what? The neurohypophysis. So among them, which one? Come on, guys. I thought you guys are already ready for this exam, endocrinology exam. Which is not? Exactly. Luteinizing hormone. FSH and luteinizing hormone is produced, by the anterior pituitary, not by hypothalamus. All right? Remember that. It's very, very important that you remember that. Okay. No, there's no thyroid hormone there. Thyrotropin down. When you say thyroid hormone, I don't know what thyroid hormone is TSH, thyroid stimulating hormone. Thyroid hormone, rather, not TSH. Am I crazy? Thyroid hormone is T3, T4. That's thyroid hormone. All right. Possibly. Depends on my leg. But I will inform you before 12 o'clock tomorrow. What am I even talking about? Yes, the answer is luteinizing hormones. You guys are very correct. It's not a hypothalamic hormone. Hold on, I'm looking for. Okay, this question. This question. Which hormone stimulates glucocorticoid secretion? Which one stimulates glucocorticoid secretion? We have the GnRH, we have the GnRH, we have the ACTH, we have the CRH, we have the TSH. Which hormone stimulates glucocorticoid secretion? We have the GnRH, we have the GnRH, we have the ACTH, we have the CRH, we have the TSH. Come on, guys. Yes, the answer is ACTH. That's very correct. ACTH stimulates the adrenals, all right? Now look at this. Look at this. Which of these hormones does not stimulate the release of another hormone by its target cells? Options. Let me read the question again so that you get. I need everybody to pay attention. Which of these hormones does not stimulate the release of another hormone by its target cells? A. TSH, B. GnRH, C. ACTH, D, PRL, E, TRH. Let me post it because like some people may be confused. I hope not. Better to be confused right now than to be confused inside the exam hall. Which of these hormones does not stimulate the release of another hormone by its target cells? We have the TSH, we have the GnRH, we have the ACTH, we have the PRL, we have the TRH. Quickly, guys. Exactly. The answer is PRL, prolactin. Prolactin just helps in production of what? Breast milk. It doesn't even push it out. It just produces it. P for P. Produces it. All right? Yes, the answer is prolactin. PRL, yes. Look at this question. As an example of the hormonal communication, when osmotic receptors of the dash detects dehydration, a signal to the posterior pituitary gland causes the release of dash. Options: hypothalamus ADH, posterior pituitary oxytocin, hypothalamus oxytocin, anterior pituitary renin, anterior pituitary antidiuretic hormone. Answer: is it A? Is it B? Is it C? Is it D? Is it E? Which one? Yes, PRL is correct for that question. Yes, prolactin is correct for that question. PRL. Guys, what's the answer to this question? Yes, the answer is A. So the receptors of the hypothalamus is what detects the dehydration, and immediately it causes the release of what? Antidiuretic hormone. All right? Because that's hypothalamic hormone. Now, when it produces antidiuretic hormone, what does ADH do? That's the question. What does ADH do? Guys, let me give you the options. What does ADH do? Causes vasodilation. It causes the release of hormones from the adrenal cortex. It increases water retention from the renal tubules. It acts as hypothalamus to decrease appetite. It causes a smooth muscle contraction in the female reproductive tract. So what does it do? Apart from dehydration, another time this ADH is released is when you have a hypotension. Remember, hypertension and hypotension depends on the amount of water in your blood. You understand? Osmolarity of your blood. All right. If there is high salt concentration, that means there's less water in your blood. You become hypotensive. So immediately you become hypotensive, the osmotic receptors in the hypothalamus will tell the body, please, make this person thirsty, or make him want to drink water. Then you also release release antidiuretic hormone. Why? So that it will stop water from leaving through the urine. Instead, it will accumulate water in the blood, thereby increasing the blood pressure. Very important that you know that. So the answer is what? C. It causes water retention from the renal tubules. All right. So there's less urine and more water in the blood. How about this? So you guys are very correct. That C is correct. How about this, guys? Look at this. What's the answer? The thyrotropin releasing hormone targets the dash, thyroid gland, thyroid hormone, hypothalamus, posterior pituitary, anterior pituitary. Answer, guys. Come on, let's go, let's go, let's go. Yes, the answer is what? Anterior pituitary. The answer is anterior pituitary. Very important that you guys know this. Extremely important. All right. So look at this. Look at this, guys. Target organs most often regulate the pituitary gland via dash. What is the mechanism of control? All right. Like when you have too much of a certain thing, how does the target organ have a say in what happens? In democracy, how does the target organ have a say? Negative feedback inhibition, positive feedback inhibition, upregulation, downregulation, antagonistic regulation. How does the target organ say, hey, stop, or hey, continue? Come on. Negative feedback, positive feedback, upregulation, downregulation, antagonistic effect. Come on, guys. Yes, the answer is negative feedback. All right. Yes, the answer is A, negative feedback. So, no, 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 no. Don't write a lot of things. I need to know how many people are responding. Somebody writes A for me. Look at this. Negative feedback inhibition occurs when dash. Negative feedback inhibition occurs when dash. Negative feedback inhibition occurs when dash. Look at the options. Thyrotropin releasing hormone, TRH, targets the anterior pituitary. Thyrotropin releasing hormone, TRH, causes the anterior pituitary to release thyroid stimulating hormone. Thyrotropin releasing hormone, TRH, targets the thyroid gland. Thyroid stimulating hormone, TSH, targets the thyroid gland. Thyroid hormone, TH, targets the anterior pituitary. Come on, guys, let's go, let's go, let's go. Negative feedback inhibition occurs when dash. Yes, let me see how many people responded. Okay, yes, the answer is E. Negative feedback inhibition occurs when the thyroid hormone targets the anterior pituitary. It's very direct, very specific question. All right, I'm looking for. I hope we know the hypothalamo-hypophyseal portal system. All right, we already discussed it initially. It connects the hypothalamus with the adenohypophysis. So I'm not going to discuss it. That's the anterior pituitary. All right, very, very important that you know that. Then look at this question. Since they are asking you some questions on endocrine, on pathology, I'm going to ask some questions on pathology. Look at this question quickly, guys. How many people do I have here? 18 people. Interesting. growth hormone, growth hormone hypersecretion causes gigantism when it begins in childhood, but it is more likely to cause DASH when it begins in adulthood. We have the myxedema, we have the Graves' disease, we have the Cushing syndrome, we have the goiter, we have the acromegaly. Quickly, guys, quickly. Yes, you guys are so correct. The answer is acromegaly. You guys are so correct. Look at this question. Of the following, I'm trying to be faster, guys, so you have to go faster with me. Of the following hormones, which has more target cells in the body than the others? Of the following hormones, which one has more target cells in the body than the others? Look at the hormones here, guys. Yes, the answer to that question is E, acromegaly. You are very correct. Yes, you are very correct. Growth hormone hypersecretion causes gigantism when it begins in childhood. So childhood is gigantism, adult is what? Acromegaly. Of the following hormones, which has more target cells in the body than the others? We have the antidiuretic hormone, we have the corticotropin releasing hormone, we have the growth hormone releasing hormone, we have the growth hormone, we have the oxytocin. Your eyes hot. I'm so sorry. Okay. Put it inside cold water. Of the following hormone, which has more target cells in the body than the others? Quickly, guys. Yes, the answer is growth hormone. You are so correct. Look at this question. Look at this question, guys. Which cell in the parathyroid gland secretes parathyroid hormone? If you don't know this question, write not sure. Which cell in the parathyroid gland secretes parathyroid hormone? Quickly, guys. Not sure. So please, if you are not sure, the answer is chief cell. All right. Thank you. A lot of people got it. I have like 7 questions to leave you guys. All right. But I have to select which questions I'm giving you. Okay. Look Look at this question, guys. Yes, the answer to that question is chief cell. You're very correct. Look at this question, guys. Which is true regarding cortisol? What does cortisol do exactly? Yes, nice that you said not sure. It shows that you are here. Look at these options, guys. Quickly, guys, quickly. Which one is true regarding cortisol? What does cortisol do exactly? Exactly, that is correct. It promotes breakdown of fat and protein. Please, you see that particular question, you must remember it. You have to. Like, you really don't have a choice. You don't have a choice. You must remember that question. This thing is lagging. I don't like it. Which of the following statements about diabetes mellitus is false? Which one is false? Which one is false? Mind you, you need to understand the question you are asked. Which one is false? Hold on, let me give you the options. So look at the options, guys. Which of the following statements is false? The statement about DM is false. A, the body produces autoantibodies that destroy the pancreatic beta cells in type 1 DM. Target cells are unresponsive to insulin in type 2 DM. Both type 1 and type 2 DM are characterized by lack of or low levels of insulin. Diabetic neuropathy is a common long-term effect of DM. Type 2 DM is more common than type 1 DM. Yes, you can write you are not sure. I'm not sure if you are not sure, guys. Not sure. Just write not sure. Which of the following about DM is false? If you look up there, I posted the options. Okay. More responses. We need more responses, guys. Please, if you are not subscribed, try to subscribe and try to click the notification bell so that you'll be able to see whenever I'm going live. Because sometimes, honestly, to send messages tires me out. Okay, so a lot of people are not sure. So let's analyze the option. Look at it. Which one is false? That's what they're asking you. Meaning that all of them are true apart from one. That's the first thing. So let's check. A, the body produces autoantibodies that destroy the pancreatic beta cells in type 1 DM. Correct. Why? Because type 1 DM is about production. That's why we give them insulin. It's about production. So that one is correct. It can't be the answer. They say which one is false. Look at number B. They say target cells are unresponsive to insulin in type 2 DM. Of course, you are producing insulin, but your cells are not what? Understanding that this is insulin being produced. That's why we hardly give them insulin. Instead, because they are producing adequate insulin. Instead, we give them things that will help to increase the sensitivity of insulin. All right? Because the target cell is not what? Understanding and recognizing what? The insulin that they are producing. So B is still correct. So that cannot be the answer. Look at C. Both type 1 and type 2 DM are characterized by lack of or low levels of insulin. Wrong. So C is the answer because we are looking for which one is wrong. Type 1 is low, lack of insulin or low level. But type 2 is not lack of insulin or low level. Type 2 is just about recognizing the insulin you are producing. If your body target cell is not recognizing that insulin you are producing, you become diabetic. It's even with the fact that you are producing insulin, and that is type 2. And that type 2 is more common than what? Type 1. which is what they say in D. In the last one, type 2 DM is more common than type 1 DM. True. Then the D, they say diabetic neuropathy is a common long-term effect of DM. True. So the one that is false is what? C, and C is the answer. I hope you guys get how we analyze it. That's how you should analyze questions in the exam if you are having a problem. This question is long, and this is the after this question, I have just 5 more questions, and we call it a day. We are not doing male reproduction today because there are very few people here. You understand? On Tuesday, minimum of 50. If it's less than 50, we're not going to do that review. So tell everybody. All right? Minimum of 50. Today I just accepted it because I've not canceled a review before. But please, next time, tell everybody on Tuesday specifically. We do male and female reproduction. Please, if you are not subscribed, try to subscribe now. Just click the subscription bell now and the notification. So look at this question, guys. And yes, I will be bringing a video on the special senses. No, you don't need to beg them. Oh. You don't need to beg anybody. We'll be bringing a question on special senses. I'll be bringing a question on special senses, a video rather, on special senses. That special sense is extremely important. So please, I'll post the video this week. I'm just waiting to get this new laptop because this one is freezing. So if I just get it on Monday, I'll try to do the video on Tuesday or Wednesday. Tuesday, am I busy on Tuesday? Tuesday or Wednesday, I'll do that video and I'll upload it immediately. So please, special senses, go read it up for your final exam. So look at this question. I'm going to post you the options. The option is a little lengthy. Oh boy. Let me reduce the font so that it will enter in one place. Let me see if you... Okay. So this is the option. No, still not complete. Hold on. Let me make it 16. Okay. So this is the option, guys. So this is this is options. I need you guys to take your time and look at that question because it's extremely important. Which of the following is the correct sequence of events? Let me see. I saw this question here now, right? I saw it here. Okay. So which of the following? I need you to just pick A, B, C, D, E. Which of the following is the correct sequence of events leading to polyuria and dehydration associated with DM? Which of the following is the correct sequence? Which one is the correct sequence? Correct sequence, guys. Let me see. 2 more people to respond. Quickly. Yes, you guys are so correct. The answer is B. Hyperglycemia, leading to, when there is hyperglycemia, a lot of glucose in the blood, it leads to glucose entering the kidney. A lot of glucose entering the kidney. All right, passing through the renal tubules. Normally, it's not supposed to pass through the renal tubules. Glucose is supposed to be what? Reabsorbed in the PCT. But this time around, it's not reabsorbed. All right, it enters the renal tubules. From there, glucose in the urine raises what? The osmolarity of the tubular fluid. What am I saying? No, hyperglycemia leads to glucose entering the renal tubules. From there, the glucose transport maximum exceeded. That's what I was trying to explain. Then from there, once it's exceeded, the glucose in the urine raises the osmolarity of the tubular fluid, leading to what? Osmotic diuresis. All right. Once it raises that osmolarity of the tubular fluid, a lot of fluid we want follow the glucose. Remember, fluid follows what? Solutes. A lot of fluid will follow it. That's why people that are diabetic are always having what? Polyuria. All right? Polyuria. A lot of urine flowing out. So there are always 3 P's: polyphagia, polydipsia, and what? Polyuria. Because a lot of fluid is flowing out, the brain, the hypothalamus, tells them that you need to be thirsty. Go and drink water. You see them drinking a lot of water. That's what? Polydipsia. Because they are very thirsty. They are drinking a lot of water. From there, they are urinating a lot. So that's the sequence, guys. Please master this sequence. You should know what comes before what. Very, very important. So I have 5 more questions or 4 more questions. All of you know about melatonin. Melatonin helps to synchronize physiological function with the cycle of daylight and darkness. So I don't want to discuss, waste time on it. You know melatonin, all of you. So look at this question. Now, this one is asking you a question on organ. I'll read out the options. Take your time to look at the question. The DASH secretes several hormones that stimulates the development of lymphatic organs and regulates development and activity of T cells. We have the thyroid, we have the thymus, we have the adrenal gland, we have the spleen, we have the parathyroid. What's the answer, guys? What's the answer, guys? The DASH secretes several hormones that stimulates the development of lymphatic organs and regulates development of activity of T cells. Which one? Thymus. Yes, you are very, very, very correct. Now, how about this one? The answer is thymus. How about this? The DASH secretes the hormone that increases the body's metabolic. Yes, thymus. The DASH secretes the hormone that increases the body's metabolic rate, promotes alertness, quickens reflexes, and stimulates the fatal nervous system. What's the answer to this? We have the thyroid gland, we have the pancreas, we have the adrenal gland, we have the parathyroid gland, we have the thymus. Yes, the thymus, yes, for the other question. So for this question, we're talking about the DASH secretes a hormone that increases the body's metabolic rate, promotes alertness, quickens reflexes, and stimulates the fatal nervous system. We have the thyroid gland, we have the pancreas, we have the adrenal gland, we have the parathyroid gland, we have the thymus. What's the answer, guys? Yes, thyroid gland. Guys, the answer is thyroid, not adrenal, please. Thyroid gland is not adrenal because thyroid gland produces thyroid hormone T3, T4, and the thyroid hormone regulates metabolic rates, all right? Makes you quick, alert, and everything. That's why when you have hyperthyroidism, right, you are producing too much thyroid hormone. You see the person is always shaking, alert, sweating, active, alert. You understand? Quick reflexes. And it affects the fatal. All right. Okay, look at this one. Look at this, guys, quickly. Look at this. What was the answer? Many hours after a meal, alpha cells in the pancreatic islet secretes dash. Why dash blood glucose? Which dash blood glucose? Which one? Glucagon lowers, glucagon raises, insulin lowers, insulin raises, glucocorticoids raises. Quickly, guys. Two more people. Come on, guys. I have 3 more questions to do. Okay, so look at this question, guys. I just pasted the options, but I've not even posted the question. Look at this question. Yes, that question is glucagon and increase. Glucagon increases blood sugar because it converts glycogen back to glucose, right? So look at this question. Parathyroid hormone promotes which of the following? It promotes which of the following? There's a question like that I saw some minutes ago. He said the dash secretes a hormone as a response to hypocalcemia. The dash secretes hormone as a result of hypocalcemia. We know it's parathyroid hormone. So now a follow-up question to it says, because any of them can come out in your exam, follow-up question to it says, parathyroid hormone promotes which of the following? Hurry up, guys. Hurry up. I need 3 more persons. Thank you so much. So what parathyroid hormone does is the reabsorption of calcium from what? From bone. All right? It increases. So it responds to hypocalcemia because they will ask you that question. Which responds to hypocalcemia? That's parathyroid. All right? What it does is when hypocalcemia, there's low calcium in the blood, it starts cutting down bone to get calcium into the blood. All right? Aha. So please, you have to remember that. Look at this question. Look at the options. Quickly, guys, quickly. Which of the following is not a cause of Cushing syndrome? Which of the following is not a cause of Cushing syndrome? Quickly, guys. Let me read this question for you before I respond to that question I posted to you. Let me read this question to you. Okay, for me, it's not a cause of Cushing syndrome. Okay, that's what I asked. Yeah. I just saw an interesting question, all right? One particular interesting question. I want to read it to you so that you'll be thinking about it. Before the discovery of these glands, thyroid surgery often led to a rapid drop in blood calcium levels, which triggered muscle contraction and cardiac arrhythmia. What glands are these? And which hormone is lacking? Let me see. I've seen this question before. Please continue responding to this particular question. I want to check if I can see this question. Can't see it though. Can't see it. Not sure, yeah. I can't see it. Okay. So back to what we were discussing before. So this question, I'm going to discuss it in when we are discussing the final review, all right? So what did I ask? I said, which of the following is not a cause of Cushing syndrome? The answer is D. Hyperactivity of the adrenal medulla does not cause Cushing syndrome. What causes Cushing syndrome is when there is ACTH hypersecretion by the pituitary. All right? Because it's ACTH, influences the cortex. You understand? Because of that, there will be high level of what? Adrenal cortex. ACTH influences the cortex. So there's high level of what? Adrenal cortex activity. All right? Which leads to excess what? Cortisol secretion. So E is there, C is there. That's cortex and cortisol. Two of them are involved. Then ACTH secreting tumors increases ACTH. It is involved. ACTH hypersecretion by pituitary, it is involved. So those are the four things that causes what? Cushing syndrome. But the medulla has nothing to do with Cushing syndrome because medulla produces what? Not cortisol. Instead, it produces what? Catecholamines. You should remember this. All right. So 2 more questions to go. We already discussed, before I give you those questions, we already discussed the characteristics of DM. All right. We talked about polyuria, polyphagia, polydipsia, even glycosuria. That's glucose in the blood, in the urine rather. All right. So when they give you this kind of question, which is not a characteristic of DM, you should know which one is not a characteristics by knowing which ones are characteristics. All right. Yes, everybody. Yeah, is which of the following enters? We are here. Which of the following enters the target cell nucleus and already? Okay, look at this question. You see, this was also this is one of the questions they asked. Let me see. So I need you guys to answer this question and second to the last question. Yeah, I see you. Look at this question very fast, guys, so that we can all call it a day. So look at this question. Which of the following enters the target cell's nucleus and acts directly on the gene? You see that thing I was telling you? I told you about the steroid hormones that enters inside and acts. So which one is steroid hormone from these options? So you should remember steroid hormones. So we have insulin, we have ADH, we have estrogen, we have glucagon, we have oxytocin. Let me see. Yes, you are so correct. Steroid hormones. Yes. An example was estrogen. You are so correct. Now look at this question before we go. Yes, steroid hormone. You are so correct. Look at this question. What is the last step of the sequence? Let me post you the options. Which of the following is the last step in the sequence of events happening when cyclic AMP acts as the second messenger? Look at the options. Which of the following is the last step in the sequence of events happening when cyclic AMP acts as a second messenger? We have the G protein activates adenylate cyclase, CAMP activates protein kinase, adenylate cyclase produces CAMP, G protein is activated by binding of a hormone to the receptor. Enzymes are activated or deactivated by the action of protein kinases. Answer: yes, estrogen is correct for that question. Estrogen is correct for that question. For this one, what's the answer? Yes, the answer is E. The last step is enzymes are activated or deactivated by the action of what? Protein kinases. All right, that's the last step. So as it is the last step, I'm going to give you the last question. All right, for endocrinology. Last step, last question. Which of the following makes I'm not going to give you option, all right? So let me see who is here and who is not here when I was discussing it. Which of the following makes it possible for even a small quantity of hormone to have a strong effect on its target cell? Negative feedback, that's A. The antagonistic effect, upregulation, enzyme amplification, downregulation. Yes, you are correct for that question. You are very correct for that question. Which of the following makes it possible for even a small quantity of hormone to have a strong effect on its target cell? Which of the following makes it possible for even a small quantity of hormone to have a strong effect on its target cell? We have negative feedback inhibition, we have the antagonistic effect, we have upregulation, we have enzyme amplification, and we have downregulation. Which is the correct answer, guys? Because some people are answering what I didn't mention. Okay, let me post it for you. Okay, look at it, guys. I posted the option already. Negative feedback inhibition, the antagonistic effect, upregulation, enzyme amplification, downregulation. Come on, guys. What's the answer? 1, 2, 3, 4. Two more people. Two more. Quickly. Okay, so the answer to that equation is what? Enzyme amplification, right? It says which of the following makes it possible for a small quantity of hormone to have a strong effect? That's enzyme what? Amplification. Now look at a question on upregulation, all right? I told you that the other one is the last question, yes, but this one, just because some people said upregulation, I just want to show you the difference when they ask the two questions. So I want you to compare this last question with this particular one I just posted now. The answer to this one I just posted is upregulation. The other one is amplification. So I need you to understand the difference. For upregulation, they are telling you which of the following is an increase in the number of receptors, making a target cell more sensitive. So it's all about sensitivity. All right. Of course, now there are a lot of medications that can cause enzyme amplification. But don't worry, this is not pharmacology. But the truth of the matter is that if you understand this, what enzyme amplification is and what upregulation is and downregulation, you'll be able to understand what we're talking about. All right? You'll be able to understand pharmacology a lot. So this last one I just posted is upregulation, in case of if you see something like this, increasing in sensitivity. But when you're talking about enzyme, you are talking about small effect, large effect. But this one is increase in sensitivity. All right? So thank you all for being here. We are few, but it still makes sense. And I appreciate the fact that you guys brought out your time to be here. And I appreciate myself for bringing out my time to be here as well. All right. But please, you have to tell every other person that is not here that they should make sure they go to the, I'll post the link to your platforms. You understand? Make sure you go to that place and yes, C, upregulation. Yes, upregulation for the last one. But the other one is enzyme amplification. So make sure you go and rewatch this. All right. And there's a video I posted for enzyme for endocrinology. Please also watch it. Compare the questions there and the questions here. All right. And when you watch it, please write ready. I always want you to leave a comment. That comment is very important to me because it shows me that the amount of people that we're able to finish the video from beginning to the end. All right. Thank you so much. I appreciate you guys a lot. All right. Thank you so much for being here. And people that are not here, tell them to make sure they go watch the videos. All right. You see, there are a lot of questions on endocrinology coming out in your final exam. And most of the questions we treated here are exactly, if not similar, to what we have here. This is your last year exam. So if you understand it very well, it helps you, right? It will. Female reproduction will. I didn't say it won't. It will. For people that are in my class in CSI, what you should be expecting is endocrinology, male and female reproduction. You understand? But for male and female reproduction, I'm going to discuss it on Tuesday as a review for you. All right? As a review for you, I'm going to discuss it. Okay, thank you guys very much. Have a nice night. Thank you. And if you have not subscribed, try to subscribe. Try to click the notification bell, all right? Thank you so much. And good night. Yeah, good night.